Namaskaram to all. A very warm welcome to 20th Parva of Prabodhini webinar series. So before starting the scientific session, let us take the blessings of Lord Dhanvantari, and hence we'll be starting by Dhanvantari Vandana.
Namami Dhanvantarim Adidevam Surasure Vandita Padapatnam Loke Jararukha Bhayamrityunasham Dadaramishan Vibhidaushadhina Dhanvantarim Ramanadham Sarvaroganivarakam Ayurveda Pravartaram Vande Piyushadayakam Sarve Jana Sukhino Bhavantu Sarve Santu Niramaya Om Shanti Shanti Shanti.
Om Dhanvantare Namaha. So with all the blessings of Lord Dhanvantari, we will start 20th Parva of Prabodhini webinar series. Our guest speaker will join us shortly, and before that, let us take just 5 minutes to revise all the rules and regulations of Prabodhini. So be with me for my presentation. Prabodhini webinar series is organized by Shri Babu Singh Ayurvedic Medical College and Hospital, Farrukhabad, UP. And as we know, Prabodhini is an effort to bring all the knowledgeable persons to you, and they should share their knowledge and they should share their practical experiences with you, so that uh, those informations given by our sages and all the rishis, munis in our samhitas, which are in the form of shlokas, in the form of formulations, they are encoded. So we need to resolve them. We need to find the exact meaning of what they have told. So it is our effort to bring all the persons who are practicing in the field of Ayurveda in different departments, in different diseases, their expertise. So they should share their practical experiences. They should share with you how they are doing, how they are solving, how they are recognizing all the diseases, how they are solving their problems. So it is our effort to help you all. And with us, our patrons are there: Dr. Shailendra Yadav, sir, Chairman JS Group; Dr. Sunita Yadav, ma'am, Director JS Group; and our principals are Dr. Manjunath NS, sir. So, and with us, we are the organizers: Dr. Nihar Ranjan Mahanta, Associate Professor from Panchakarma Department; me, Dr. Preetimai Sahu, Associate Professor from Kaya Chikitsa Department; and Dr. Shrinas BS, Assistant Professor from Panchakarma Department. So as we know, we have started this journey from 25th April 2023, and we had covered so many topics in our journey. It is 20th episode today, and we had so many speakers with us in this journey, and they shared their experiences, they shared their knowledge with you, and I know you all have got so much benefit out of this. And today we have our guest speaker as Dr. Shripathi Acharya, sir. He is the director from Department of PG Studies and Professor HOD of PG and PhD Department of Kaya Chikitsa from Munial Institute of Ayurveda Medical Science, Manipal. He will be delivering his lecture on Ayurvedic management of liver cirrhosis. So I think today's episode will also be very interesting, and you all will ask your queries and questions to sir. Sir will surely resolve your problems. So next, we have some rules and regulations to revise. Registration is mandatory. Registration is done through filling the Zoom forms provided in the link. After filling in the Zoom forms, you have to join the WhatsApp group Prabodhini through the link provided, as all the further proceedings will be intimated in the group. On successful submission of the form, you will get a confirmation mail containing Zoom meeting joining link. It is individual link for everyone. Those people who will register, they will receive the link in the registered mail. Please join the webinar with the link provided. Your name and email ID in the Google form should be correct, as it will be used in your e-certificate. So be very careful while filling in your names and email IDs. E-certificates will be provided to all the participants attending the webinar more than 45 minutes. So attendance is compulsory, and many people, they send messages that we failed to attend, please give us the certificate, but we don't entertain them. So please be very careful, attend the webinar. It is for you people only, right? So 45 minutes attendance is compulsory for all, especially to get the e-certificates. You will get your e-certificates through email ID registered with us within 7 days, and thus there is no need to share your email IDs during the webinar sessions. So enjoy the scientific session. Try to grasp all the things what our speakers are sharing with you. With this, I end my presentation here. Thank you so much. And next, we will move to the scientific session. I welcome you once again to the scientific session. So our today's guest is Dr. Shripathi Acharya Ji sir. He is from Manial Ayurvedic College under Mangalore University, and he's from Manipal, Department of PG and PhD Studies. He is the WHO collaborator in India. He's the member of the Scientific Advisory Board, and he's the member of Health Technology Assessment International, New Jersey, USA. Along with, he is the member of Asian Consortium ISPOR New Jersey, USA. He is the member of ISPOR New Jersey, USA, and the member of Vigyan Bharati, India. He is the member of Society for Conservation and Cultivation of Indian Medicine and Aromatic Plants, New Delhi, India. He is the executive member of Swadeshi Vigyan Andolan, Karnataka, India. He is the member of Society for Ethnopharmacology from Kolkata, and he is the member of United Nations Foundation, Washington, USA. So I think you are now very much. It is really very. Um, It is really very privileged to welcome such a great personality between us. He has 24 years of teaching experience as a permanent teacher, and he has given many guest lectures, like more than 11 guest lectures in state and national level conferences. He has also presented many papers in national and international journals and articles. He has published more than 20 articles he has published in journals, and he has covered many diseases like mostly ulcerative colitis, liver disorders, sandhigat vat, and respiratory disorders, along with Arshurog in general practices like Swarna Vasanta Malati evaluation in general practices, and Kushmanda Valeha in primary healthcare. So many diseases he has done research, and he is very interested in research work. Along with it, he is very interested in writing books. So he has authorized many books. First, I'll surely read all the books here. He has published Stholya, a book on obesity in Kannada. He has published a book in Sharir Kriya Vigyan. It is a textbook for our BMS students in Ayurveda Physiology, taken up by Chokamba Press for publication. He has also published books in Kai Chikitsa, like textbooks. He has published researches in Ayurveda, one book, and Ayurveda Vigyana book in Kannada. Then Agroshadhi Galu, Samanya Rogagala Chikisali Ayurveda, Hridaya Rogagala Chikisali Ayurveda. Then again, one more book, Updated Ayurveda, and Ayurveda Gidamuli Molike Galu. Two books are there. Then Vrikka Rogada Chikitsayali Ayurveda. So many books he has published. He has a vast knowledge and so many articles, so many research papers he has published. So I don't think I'll take much time because it is really more than enough to introduce him. He is a very talented person. And I will now hand over this session to Shripathi Acharya sir. He has already joined us. Namaskar sir. We welcome you all to today's session. And I'll hand over this session to you so you can start the presentation. Sir, please unmute yourself. Sir, please.
Hello. Is it audible?
Yes, sir. Yes, sir. It is.
Okay. So I am extremely sorry that I have joined the meeting as my new system there some problem was there. Okay. I am extremely thankful for the organizers for Shri Babu Singh Ayurveda Medical College faculty, principal, faculty and students and the management for giving me opportunity to share my experiences in the subject liver cirrhosis. So, and I'm also thankful for the madam for giving my introduction, sweet introduction. Thank you, madam. So let me share the PowerPoint and talk. Is it visible?
Yes, sir. It is visible.
Okay. The topic is Ayurveda management of liver cirrhosis. Actually, the liver is an organ which is amenable for damage. So main causes are like alcohol or other hepatotoxic drugs or viral infection and the like. So cirrhosis of the liver is a disease, is a chronic disorder where there is destruction of the hepatocytes, that is wedge-shaped necrosis takes place, followed by abnormal regeneration and extensive fibrosis. And the liver functions naturally will decrease. So we have only one liver and it is having major functions like metabolism of proteins, fats, and carbohydrates, storage of vitamins, and vitamin K, vitamin K absorption, and also detoxification of the drugs, and formation of new RBCs, erythropoiesis, erythrolysis, erythroplasia, and production of bile, etc. So when the liver is damaged, naturally the functioning of the liver will be reduced. So liver disorder are on the rise in the Indian population due to environmental pollution, altered lifestyle and food habits, psychological stress, and chronic alcoholism. The incidence of liver disorders has been raised. So to count viral hepatitis, alcoholic liver disease, cirrhosis of the liver, amoebic liver abscess, fatty degeneration of the liver, and carcinoma of the liver are some disorders which occur in the liver. So coming to normal histology. So you can see in the first diagram, you can see in the liver histology. So in the central vein is there, which is surrounded by hepatocyte, lamina of the hepatocytes, hepatic lamina. The hepatocytes are polygonal cells, epithelioid cells with central nucleus, and hepatic lamina will be around the central vein, and between the hepatic lamina there are liver sinusoids where the blood coming from the hepatic artery tributaries will enter the hepatic sinusoids, and also the tributaries of the bile canaliculi also will be there. And in the sinusoids, the nutrients are taken by the hepatocytes and ultimately the blood goes to the central vein. From the central vein, it reaches to through the branches of the hepatic vein, and it enters the hepatic vein, then into the inferior vena cava and into the systemic circulation. So there is the enterohepatic circulation, that is from the intestine. The nutrients are absorbed and they go to the hepatic artery, and then they go to the sinusoids and to the central vein, and the tributaries of the hepatic vein and to the inferior vena cava. This is the uh, intrahepatic circulation. So this in the periphery of the hepatic lamina, there will be portal triads. Portal triads, which is comprising of branches of hepatic artery and bile canaliculi, isn't it? Okay, in the right you can see the cross. So these are the symptoms of liver disease: abdominal swelling or ascites, dry mouth, yellowish of the skin, as in acute stage like hepatitis, red spider-like veins in the chest, especially memory problems, numbness in the extremities, fainting, redness of the feet, and bleeding from enlarged esophageal varices. These are the common symptoms, isn't it? So the alcoholism also leads to cirrhosis of the liver. So in alcoholic liver disease, there are three stages: alcoholic fatty liver, isn't it? Or alcoholic steatosis, alcoholic hepatitis, and third stage is alcoholic cirrhosis. So alcoholism causes cirrhosis, that is known as Lanex cirrhosis or nutritional cirrhosis, isn't it? So Ayurveda medicine has a positive role in the management of liver disorders. Palatrikati Kashaya, Guduchi Kashaya, Aragyavardhini Vati, Bhumyamalaki Salsa, Godanti Vasma, Triphala tablets, Pravala Panchamarasa, and few formulations are commonly used in these disorders. So these are the few. So Guduchi will give in the treatment, isn't it? This is a to brief the classification of liver disorders includes viral hepatitis, alcoholic liver disease, common liver disorders encountered. Okay, amoebic liver abscess, hydatitis of these are hydatitis of the liver, carcinoma of the liver, secondaries in the liver, and cirrhosis of the liver. Cirrhosis of the liver is a pre-malignant condition, so it often leads to hepatocellular carcinoma, primary cancer of the liver. So in the cirrhosis of the liver, when then a test is there, that is alpha fetoprotein. Alpha fetoprotein, if it is so, as a normal liver is comprised of hepatic lobules. There is difference between hepatic lobules and hepatic nodules. Hepatic lobules are seen in the normal liver, and hepatic nodules are seen in cirrhosis of the liver. So, depending upon hepatic nodules, three types of liver cirrhosis are classified, like micronodular cirrhosis, macronodular cirrhosis, and mixed type of cirrhosis. So in alcoholism, mixed type of cirrhosis or micronodular cirrhosis is a normal liver hepatic lobule. We have just discussed central vein in the center and hepatic lamina concentric, and in the periphery of a lobule there is hepatic triad and portal triad, isn't it? The tributary of a hepatic artery, bile canaliculi, and portal vein. This is under microscopy a slide of fatty degeneration. You can see the hepatocytes studded with the lipid droplet, isn't it? That shows the center of the hepatocyte is occupied by the lipid, and the nucleus of the hepatocyte is pushed into the periphery, producing eccentric nucleus that is seen in fatty liver. the normal liver. So this is cirrhosis. You see under microscope, the slide of cirrhosis is like this. You can see in the center, in the center, you can see the fibrosis, extensive fibrosis. In the periphery, you can see hepatic nodules. Isn't it? In the hepatic nodules, normal configuration of the hepatic lobules is lost, and it is bizarrely there. That is structure is there. The central vein is not there, and it is known as hepatic nodules. So, formation of multiple hepatic nodules, extensive fibrosis. These are the most common features of cirrhosis of the liver under histopathological study. So, types of liver cirrhosis, just nutritional cirrhosis or Linac cirrhosis, isn't it? Or alcoholic cirrhosis, Indian childhood cirrhosis, biliary cirrhosis, cardiac cirrhosis, cirrhosis due to altered copper metabolism, cirrhosis due to hemochromatosis, and idiopathic cirrhosis. And post-necrotic cirrhosis also there. Isn't it? The metabolism of copper and iron overload can also lead to cirrhosis of the liver. In Indian childhood cirrhosis, the child, especially in the villages of Rajasthan, child is fed with the food items contaminated with copper by placing it, storing it in copper vessels for more time. The food items get contaminated with copper, and if it is fed to the infants or children for longer time, there will be liver damage and there will be cirrhosis. That is known as Indian childhood cirrhosis. In hepatitis B, also there will be that goes to fulminant stage of hepatitis and ultimately cirrhosis. Cardiac cirrhosis is also there, and idiopathic, where the cause is unknown. Let us discuss the symptoms or clinical features of cirrhosis of the liver. In cirrhosis of the liver, main symptoms are loss of appetite, ascites, weakness, emaciation of the extremity muscles, and ascites. Then gynecomastia, spider ecchymosis, telangiectasia, and whole body swelling or general asarca, bilateral pedal edema, and in some extreme cases, there will be esophageal varices that causes coffee ground vomiting or melena. Black tar stools are passed out. Sometimes diarrhea also occurs. So, in the complications like there will be salt and water overload or retention, that causes volume overload, that causes left ventricular failure and pulmonary edema and respiratory distress. In some cases, when the blood is partly digested, but bleeding in the usual varices, that causes a partial digestion in the intestines, and there will be formation of ammonia. Ammonia is absorbed, that is not converted into urea, that is absorbed into the circulation and goes to the brain, and that can cause altered sensorium, like delirium, like that, isn't it? Pre-coma, coma, etc. Hepatic, encephalopathy. So the symptoms like hemorrhoids can also occur because of portal hypertension. There can be hemorrhoids and ascites, that is accumulation of fluid in the abdomen. So the capitment is that means the concentric vein in the abdominal wall that is engorged. So capitment is seen in the extreme cases. So everted umbilicus is seen. So main features you commonly see is loss of appetite, and ascites, breathlessness, cough with expectoration, bilateral pedal edema, general anasarca, and these are the symptoms. Melena and hepatitis. These are the common symptoms. So when the patient ascites is severe, then that will increase the intra-abdominal pressure, then intrathoracic pressure, and that causes breathlessness or difficulty in breathing. Pulmonary edema also causes breathlessness. So diagnosis is made in the basis of the tests. So the examination, clinical history, examination of the patient, and the tests, biological and some other tests, some ultrasound, etc. Isn't it? So we have discussed the few clinical features and the science. And next is the test, the laboratory test, the experimentally the lipid, the uh, liver liver function test is the main one, isn't it? Under that, serum bilirubin, direct bilirubin, indirect bilirubin, and serum total tonicity is altered, and small size of the liver becomes small. Okay. On examination, abdominal examination, usually the liver may be enlarged, it will be hard and nodular sometimes. Okay. Or it may be constricted. Most of the time, not make liver. It is a constricted liver is seen. Okay. So, pulmonary edema features like breathlessness. In non-examination, there will be basal capitation, isn't it? Basal capitation. And on X-ray, there will be features in chest X-ray PAU. In pulmonary edema, there will be features like prominence of the upper zone vessels, diminution of the lower zone vessels, and curly A, B, and C lines, and butterfly pattern or bad swing appearance, and pleural effusion. So these are seen. And left ventral hypertrophy is seen in the X-ray. Left ventral hypertrophy, that is cardiomegaly with the apex, which is shifted downwards and laterally. That is X-ray finding of left ventral hypertrophy. These are all seen also co findings in case of as complication in case of cirrhosis of liver. Isn't it? So coming to other formulations which are used, Tripala Kashaya, Arajavardhinivati, Palatrikadi Kashaya. So in Udupi, Palatrikadi Kashaya is commonly used, very frequently used in case of cirrhosis. Pravala Panchamarasa, Mukta Panchamarasa, Ramadugarasa, Godanti Basma, and Pravala Pishti, Mukta Pishti, Pravala Basma, Mukta Basma, Unimbadi Kashaya, Kumari Asama, Narikela Jala, Puranama Swarasa, Puranamadi Mandura, Guruchi Kashaya, and Akamachi Nasa. So actually, if you analyze the formulations, the ingredients of formulation and ingredients of the formulations used in cirrhosis of liver, and if you see their, if you study their actions, the following actions will be more common, like Deepana, Pachana, Rasayana, isn't it? Diuretic or Mutrala, Kasahara, Shwasahara, Malavatanulomana, Virechana, Murdu Virechana, Balya, Brahmana, then Jivaniya, Ojaskara, protein supplementation. That is very, very important thing. Protein supplementation, because serum total protein will be low. Hyperproteinemia will be there. Less than 5 milligram percent will be serum total protein, and the reversal of albumin globulin ratio will be there. So naturally, you have to supplement the proteins. So high protein diet is required, is advised. Isn't it? You have to give Deepana Pachana also, otherwise it won't be digested. Deepana Pachana can give Pipali Sherpaka. Pipali Sherpaka is a good medicine in case of cirrhosis of the liver, or also, isn't it? Or you can give other Ingvatrachana, Nodbaskara also you can give, or Lakshana Devati, that Aragavadinasa. Aragavadinati is increasing the appetite. So Picarrhiza Kurova, the Katakarohini is the best hepatoprotective drug, as also hepatic stimulant. It is also Kalagam. It will increase the bile secretion. It will increase the Agni also. It will remove the Agni Mandya, isn't it? This is Katuki. Katakarohini Kwata is available in the market. That is very bitter, but it has a very good result in case of liver. Otherwise, you can give Aragavardhinivati. Aragavardhinivati is also main ingredient is the Katakarohini, which is the best hepatoprotective hepatic stimulant and coagulagon. drug, and also rasayana drug. Puranavadi Mandara we give. Puranavadi Mandara is it is diuretic, mutrala, and it is emetanic, mutra raktavardhaka, isn't it? Shofahara. So these are rasayana, these actions are there. Puranavadi Mandara. Usually I used to give this combination. That is Pali Sharapaka and Argavadini Vati, Gudanti Basma with Narakela Jala, Puranavadi Mandora. So like that, isn't it? Guduchi Kashaya, Guduchi Kashaya, Karjuradi, Manta. These are the Phalatikadi Kashaya or Triphala Kashaya. These are the most in Phalatikadi Kashaya, ingredients are Triphala and bitter drugs. Bitter drugs like Nimbatok, Totukuroini, Guduchi, and Patola. Isn't it? So that is they are the ingredients of Phalatikadi Kashaya. It is also very frequently used in case of cirrhosis of the liver. So Triphala Kachaya is very Malavatan Loman, isn't it? Pitta, Rasayan, isn't it? And antistress also. We have Palatika Kachaya, it is Malavatan Lomana, Virechana, and also it is containing hepatoprotective drugs, Rasayana drugs also. Pravala Panchamrita and Mukta Panchamrita, they are Sudhavargiya formulations which Pitta action, isn't it? So suppose in cirrhosis, in alcoholic cirrhosis sometimes gastritis also will be there, isn't it? Because of chronic alcohol chronic alcohol intake, isn't it? So Pravala Panchamrita acts as antacid also, Pittahara also. So that will relieve symptoms. So in the same time, you can give Karjuradi Manta, that is Kajura, Draksha, Parushaka, Amalaki, and Tintatika. So this is also soothing action on the stomach mucosa, and that's a Pitta action. So it relieves gastritis symptoms or Malapitta like symptoms are relieved. So Godanti Basma also, Godanti Basma is Pitta and Jarahara and also Mutra, isn't it? Ravara Pishti, Mukta Pishti are Pitta drugs. Ravara Basma, Mukta Basma. Bunimati Kashaya is also containing bitter drugs which are Pitta, isn't it? Suppose loss of hepatitis. Kumari Asava, Kumari, aloe vera is the best hepatoprotective drug and also hepatic stimulant and cholagogue. So it is also given in case of liver disorders. Narikela Jala is a diuretic, contains high potassium. So it is useful in case of cirrhosis of the liver. Pranava Sarasa is diuretic. Pranava we have discussed. Guduchi Kashaya, Guduchi again hepatoprotective. Rasayana, best immunomodulator drug. Antistress, adaptogenic. Isn't it? So these actions are there. And hypoglycemic, these actions are narrated. In Kakamachurasa is Pitara in function. So Patyas in liver disorders, you see the Alabu and Mulaka. They are best Patyas and Ikshu. These three are best Patya in liver disorder. Suppose inflammatory conditions is there. So alcoholism, there can be hepatitis, simultaneously cirrhotic changes, inflammation also there, and degeneration also there. You can give this Alabu and Mulaka also. Alabu, it is water guard, isn't it? And Mulaka, that is radish. So they are Patya in case of liver disorders. Sarasa is also Patya in liver. So in the Patya, this is an inflammatory condition in the liver is associated with the cirrhosis. Can you high carbohydrate diet, fat-free diet, Ikshu Rasa, that is sugarcane juice, Shastika Shali, Narikela Jala, Lagu Supacha, Ahar. This was practically advised, isn't it? Apatyas are fried and curried food items, excessive salty and pungent food, Atikatu, Amla, Lavana Sevana, exercise, and Atapa Sevan, exposure to bright sunlight. Single herbs used in liver disorders, like Guduchi, that is Tinospora cordifolia. That is the best immunomodulator drug, hepatoprotective and hepatic stimulant also. Rasayana. Kutkuroini, there is also best hepatoprotective drug. A lot of research has been conducted on this and proved to be hepatoprotective, hepatic stimulant, Kalaga, Rasayana, Kasa Shasa, Mumiamalaki, Valence that is the best hepatoprotective drug. Antiviral also. So research has been conducted in Banaras University regarding its role in the hepatitis B and just found effective. Tripala is a Malavatan Lomana Rasayana drug, isn't it? It's also useful in the inflammatory conditions associated with the cirrhosis. Bunimma, that is Andrographis paniculata, and Kiratikta Shripathi Acharya Akamachi. Other drugs, Dronapushpi, that is Leucas aspera, Ikshu, that is Saccharum officinarum, Gukshura, Tribulus terrestris, the diuretic drug, Mutrala, Puranama, Borrevia diffusa, the root is used, Caravelaka, Memordiaca, Charantia, is Tikta Rasa, the Ahara comes, is also is a Pitaverechaka, isn't it? Mulaka and Alabu, they are Patya also, and single drugs which can be used in case of cirrhosis of the liver. So again, cirrhosis of the liver is a condition with the necrosis of hepatocytes followed by abnormal regeneration and formation of multiple nodules and extensive fibrosis and decreased liver functioning. When we see signs and symptoms, common symptoms are loss of appetite, distension of the abdomen, ascites, pedal edema, that is bilateral, liver palm, that is bluish purple discoloration in the palm, caput medusae, that is, these are large, visible, distended, engorged para-umbilical veins due to severe portal hypertension. Telangiectasia, ecchymosis, melena. Melena means black tarry stools because of blood content in the stools. Coffee ground vomiting, that is the blood coming out of by rupture of the esophageal varices that goes to stomach, half digested by the HCl, hydrochloric acid, becomes acid hematine, and that becomes irritant and it is vomited out in the form of coffee ground vomiting. Hematemesis, fresh blood may also get vomited. Gynecomastia in males, and amenorrhea in females. Again, medicines for cirrhosis are Palatrikadi Kashaya, Argyavardhini Veti, Puranavadi Mandora, Pravada Panchamatarasa, Mukta Panchamatarasa, Yakradari Loha, Yakrat Plihari Loha. So there are some. So many are others also that. Kumarya Sava, Palatrikadi Kashaya, there's over, isn't it? Like Patola Katuroinyadi Kashaya, Patola Adi Kashaya. Yavadi Kwata. Like that. Isn't it? These are some of the tricks. Then Pravada Pishti, Mukta Pishti, Pravada Panchamata, there's a Kamadharasa, Vidmuktika, or plain. There also can be given, isn't it? Pali Shirpaka. So it depends how much morbidity has occurred and which organs, which system is involved more. According to that, you have to select the formulation or drug, isn't it? Suppose there is a pulmonary edema is there as a complication, you have to give diuretics, Puranavadimandra, Puranavasava, these you have to give, isn't it? Or Shetavarpati, this you can. Along with the Kasahara and Shasahara drugs, expectorants, Ayurvedic, isn't it? You can give Talzazurna, Shitabalazurna, isn't it? Somasava, Kanakasava, Pushkaramalasa. So also depends on the system, on the presenting symptom, isn't it? So you can, if left frontal failure is there, you can give Arjuna Churna, Tak Churna also, isn't it? Arjuna Arishta or Arjuna Tak Churna. If there is hemorrhoids, you can give Tripalavati, Tripala tablet, isn't it? Or you can give Abhay Arishta, Ushirasava, like that. If there is a melina, you can give Yakar Ratapita Kulakandanasa, Yakar Prihari Lava, isn't it? Ushirasava. These are effective. Yes. And if central symptoms are there, you can give major sayanas, CNS stimulants also, isn't it? Depending upon the presenting symptom. If diarrhea is there, you anti-diarrhea, the Atisarak Naushadhi, you have to give. Sometimes in terminal stage, the complication like diarrhea, yes, which is not controlled. Can you Putajaganavati, Utsagadiganavati, Putajarishta, like that, isn't it? Bilateral pediatric edema is there. You can give Puranavadi Mandura, Puranava Derishta, Peta Patpati. This you can Gokshura Bija Churna. This you can give. General Sarka is whole body swelling. You can give similar drugs, Mutala drugs, Malavatan Loma drugs, Protahara drugs, isn't it? Diuretics. They can give protein supplementation. Protein supplement is very important because when serum total protein is low, there will be general answer, isn't it? Or bilateral pediatric. Why? Because you see in the blood inside the blood vessel, the two pressures are, isn't it? One is centripetal and another centrifugal. Centripetal force is a colloidal osmotic pressure, and centrifugal force is a hydrostatic pressure, isn't it? When hypoproteinemia is there, naturally the centripetal force will be less. So there will be extra fluid infiltration into the tissue, subcutaneous and the interstitial space, causing general shock. In such cases, you have to give high protein diet. Protein supplementation is actually an integrative approach. So you have to give Mamsarasa, Ajam Sarsana. So like that. Or high protein diet it should be given. This corrects the serum total protein, reverses the normalizes the albumin globulin ratio. Why albumin globulin ratio is reversed in cirrhosis liver? Because the albumin is in the liver normally. When this decreases, this albumin decreases, naturally the globulin concentration will be more than albumin. That will be reversal of normal albumin globulin ratio. Normal ratio is 3:2. That becomes reversed. Right. So naturally you have to give protein supplementation by giving high protein diet. It's very, very important. So this we are discussing, isn't it? Yava is Mutrala. Vatahara, Mutrala, isn't it? That reduces the Yava Manda you can give, isn't it? The diuretic. So it reduces the edema, isn't it? High protein diet, low salt diet, fat free diet, Alabu, Mulaka and Yava Manda and Narakila. Apatyas. Apatyas are fried and curried food items, fat containing food. Atikatu Amla Lavandra Sekta food. Pitavataka Ahara. What happens if you take more lavanas? That will be salt and water retention. Again, that will increase the shofa, sarvanga shofa, also pedal also ascites. So you have to restrict the sodium. You have to restrict the water intake. So you have to monitor the blood pressure. Okay, if the blood pressure is high, definitely you have to restrict salt and water. If it is low, hypotension is there, then you can supplement salt. You can give more salt. So it depends on the stage and state of the disease. Without the Ahara, best avoid to Tishna, Ushna, isn't it? There will be already gastritis in the amylopathy symptoms. You should avoid this Katu Lavana, Katamla Lavana, you have to avoid, isn't it? Katamla, yes. Tatra Martam Granthi, Trayastikta Dekavam. Kashaya Tikta Madura, Pitta Manye Kurvate. The Pitta is increased, suppose the air to give Kashaya Tikta Madura in inflammatory conditions. Suppose already inflammation is over, degeneration has occurred, normal degeneration with the extensive fibrosis and formation of nodules. Then you can, the condition is not so good, prognosis is bad. Earlier conditions of cirrhosis that can be managed, but later conditions with complication definitely very difficult to cure. Fatty liver, similarly, this early stage, that can be, these symptoms will be there. So before cirrhosis, they will occur. So in fatty liver, these symptoms, these medicines are given. Similar, isn't it? Similar. So preventive measures in liver disorders and cirrhosis of liver, intake of madhurasa pradhana ahara, avoidance of pittavardhaka ahara vihara, avoidance of bright sunlight, avoidance of curried, fried and vadahi wood, avoidance of high fat diet, less intake of excessive katu amla lavana yuktahar, and the substances which cause cirrhosis, like alcohol, use of hepatotoxic drugs, isn't it? And low quality food diet, they can induce cirrhosis of liver, or in copper altered metabolism or iron overload. You have to restrict those things, isn't it? The copper, less copper should be, means it should be restricted. Copper containing material should be restricted in Wilson's disease. And hemochromatosis, especially when the blood is given repeatedly, that will cause a high load of iron in the body. That is known as hemochromatosis. That can also lead to cirrhosis of the liver. Then you have to restrict it. You have to do some chelates or chelating agents you have to give. So there is other disorders you have to give this treatment, isn't it? In amoebic liver abscess, anti-amoebic treatment and surgery. In hereditary cyst, it is worm infestation, you have to give surgery. You have to do surgery. In hepatocellular carcinoma, like symptoms will be loss of appetite, progressive weight loss, progressive anemia, loss of strength. Ultrasonography is confirmatory. Treatment is Amritaballa Tagaleya. So cirrhosis of the liver many times leads to malignancy of the liver. Then you have to give Amritaballa Tagaleya, Ballata Kavati, Chitrakadivati, Chitrakari Tekileya, Palatrikadi Kashayam, Arogyavodinivati, Kanchana Guru, Raudra Rasa, and Sada Pushpa, Putraswarasa. This way, this alpha fetoprotein, if it is raised, it is a sure case of malignancy of the liver, isn't it? Secondary is urine for urobilinogen was C3C, obstructive jaundice, isn't it? Bleeding time, clotting time, these two for management. Alpha fetoprotein to confirm malignancy. This we have discussed. So alcohol disease, terminal stage, cirrhosis of liver. So you have to treatment, low salt diet, high protein diet, madhurasa pradhana ahara, mudga, macha, mamsa, ukutanda. This can be given. Correcting the appetite, after correcting the appetite in the liver. And food items which are rich in protein. You have to give deeper pachana of this, then you can give high protein diet. So in hepatitis is associated nausea and symptoms like nausea and vomiting. So you can give lagu supacha ahara, deepana pachana drugs should be given. And alabu and mulaka are also pathe. coming to discussion, liver disorders are usually presented with symptoms like jaundice, loss of appetite, lethargy, and later stages result in ascites, general circle, emaciation. Extensive damage of the liver usually ends in cirrhosis of the liver or hepatorenal failure. In most terminal stages, there will be altered sensorium like stupor, delirium, precoma, and death. Loss of appetite, weight loss, and jaundice, the most common symptoms in liver diseases. This is how the cirrhosis takes place, isn't it? Fatty liver, hepatitis, and fibrosis leads to cirrhosis of the liver. Next stage is carcinoma. After cirrhosis stage, next stage, patient goes to carcinoma of the liver. You see, fatty liver, NASH with fibrosis, cirrhosis, and decompensated cirrhosis. These are the symptoms. So viral hepatitis usually get cured within 1 month by proper Ayurvedic treatment. Hepatitis B, of course, sometimes leads to chronic active hepatitis and cirrhosis of the liver. Cirrhosis of the liver in initial stage responds well to Ayurvedic treatment, and in later stages it will end in an incurable stage. These patients end in gross ascites, left ventricular failure, and pulmonary edema. So treatment management becomes very difficult. Some patients develop severe anemia with eczema. It is considered as pre-malignant condition. That is, cirrhosis of the liver is considered as pre-malignant condition and ends in carcinoma of the liver. Certain hepatotoxic drugs like anti-COX treatment, NS non-steroidal anti-inflammatory drugs, and alcohol cause liver damage and hepatitis. In such cases, we have to stop injection of drugs and alcohol and rigorous treatment for hepatitis and suitable patha. Hepatocellular carcinoma is usually fatal. Even secondaries in the liver cannot be completely cured. Only palliative treatment can be given in such conditions. In a nutshell, cirrhosis conditions like hepatitis, viral hepatitis, alcoholic hepatitis, and early stages of cirrhosis of the liver can be better treated by other medicine. However, the later stages of cirrhosis of the liver with the severe complications often become fatal. So, to conclude, Ayurveda medicine has a positive role in the management of liver disorders. So, viral hepatitis, good treatment is there. In cirrhosis, however, in the early stages, better management can be done. But in later stages, treatment becomes difficult. So, alcoholic liver disease and cirrhosis of the liver if gets higher treatment in earlier stage, better will be the outcome. So, however, at later stages, the treatment becomes difficult in cases of alcoholic liver disease and cirrhosis of the liver. By following disease-specific medicines for comorbid conditions, following strict patya, diet and alterations in lifestyle results in better outcome in these patients. Patya plays a significant role in management of liver disorders, especially in cirrhosis of the liver. So these are the symptoms. So today we have discussed about the Ayurvedic management of liver cirrhosis. So once again, I am thankful for the organizers and the delegates who are patiently hearing my experiences. Thank you.
Thank you so much, sir. It was a very nice presentation and so many things you summarized in your presentations. And sir, next we will be having a Q&A session. And to conduct this session, I will invite our assistant professor from Kaichigisa department, Dr. Samshul Islam. So please take over the session, Dr. Samshul, and you can unmute and we will take questions from our delegates. So all the delegates are requested to put your queries and questions in the chat box, which will be discussed in this session. And we are waiting for your questions.
Thank you, sir, for your valuable speech. And in certain short time of period, I am calling you, and then you accept this invitation and give us such a important of how to treat liver cirrhosis in Ayurveda. So, a few questions arise from the audience as well as some of our participants also give some feedback of the questions. And that first question is, sir, come is hepatofibrosis in Ayurveda. Is there any treatment, sir? And what is the treatment? If possible, sir, please.
Patrick, what is the question, please?
Hepatofibrosis in Ayurveda, is there any treatment? There is.
Cirrhosis,
Hepatofibrosis.
hepatofibrosis.
Yes, sir.
Fibrosis in the liver, isn't it?
Yes.
So, actually, fibrosis seen in cirrhosis also. So, similar medicine is given, like hepatoprotective, hepatic stimulant, Dipana, Pachana. These similar drugs are given.
Okay. And another of our participant has one question that how do I know if I have liver cirrhosis? It's a good question, I think so, but I don't know. Is it?
Okay. Actually, in the history, there will be common symptoms in cirrhosis patients: loss of appetite, emaciation, ascites, and cough, figure, and vomiting. Some cases, and there may be melena. If a patient is male, gynecomastia, and hemorrhoids is often seen, and uh, so these are the and some cases telangiectasia, then ecchymosis, isn't it? So these are the few common symptoms. Then on examination, so there may be suppose volume overload, retention of sodium and water, volume overload. Usually there will be patient the symptoms of left ventricular failure and pulmonary edema, isn't it? Like orthopnea, cough with expectoration, bilateral pedal edema, the bilateral on examination, the crepitation, basal crepitation, on X-ray finding of I have already told you, in X-ray finding of pulmonary edema as complication of cirrhosis of liver, there will be features like prominence of the upper zone vessels, that is known as antler sign, and diminution of the lower zone vessels, and Kelly A, B, and C lines, and butterfly pattern or bat swing appearance, and features of pulmonary edema. There will be left ventricular hypertrophy also. That is identified by the ECG finding and also chest X-ray finding. In chest X-ray finding, the cardiomegaly will be there. That is cardiothoracic ratio more than half, and the apex shifting to laterally and downwards. So that is the X-ray finding of left ventricular hypertrophy, which suggests left ventricular failure. The features of left ventricular failure are lethargy, difficulty in walking, exertional dyspnea, especially in the night time, sudden patient awakes because of breathlessness and sits. That is orthopnea, and these symptoms are respiratory symptoms will be there. So these are the comorbidities in cirrhosis of the liver. So other the capitment is in the in early stages of ascites, these are this Nabi, that is the umbilicus is everted, isn't it? So there will be capitment is features of portal hypertension may be seen, isn't it? And puddle sign or shifting dullness, isn't it? These features of this ascites, isn't it? So then, so these are the clinical these tests. In ECG, the features of the cardiomegaly, the left ventricular hypertrophy is seen, isn't it? In ECG, left ventricular hypertrophy pattern is there will be increase in the amplitude of waves, in the amplitude of waves in the normal pattern will be there, but increase in amplitude waves in the chest leads. That is, the S wave is deeper in the right chest leads, and R wave is taller in left chest leads. That is, the S wave is deeper than 25 mm in V1 and V2, and R wave is height is more than 25 mm in V5 or V6, and some is more than 35 mm. So these features are the X-ray findings of left ventricular hypertrophy, and that is seen in as a complication of cirrhosis of the liver. We can see these changes. So then we can see the features also, ECG and X-ray study. So we can confirm the complication like left ventricular hypertrophy, left ventricular failure, and pulmonary edema in the case of cirrhosis of the liver. So this is how since the later stage is common. In cirrhosis of the liver, in later stages there will be severe ascites, especially there is especially distress and features of left ventricular failure and pulmonary edema. So that can be detected by the physical findings in the examination and also by the laboratory and the tool, the other tools like ECG and X-ray, isn't it? So by that way, so to plan the treatment is very important. This is how we can. So suppose inflammatory stage is associated, then you can see the liver function test, isn't it? The serum total bilirubin, serum direct bilirubin, indirect bilirubin, then SGO, ALT, AST. If inflammatory signs are associated. If cirrhotic stage is there, you can confirm by serum total protein, hypovolemia, isn't it? And albumin globulin reversal. That is, serum albumin will be lower than normal, serum globulin will be higher than normal, and the ratio between serum albumin and serum globulin is reversed. So these are the confirmatory findings in case of cirrhosis of the liver. However, you can have a differential diagnosis. This can also occur in case of nephrotic syndrome and in case of other causes, hypoproteinemia, other causes like malabsorption syndrome. Isn't it? Yeah. So that we have to differentiate, isn't it?
Okay. So another question is, sir, one of our participant, Dr. Praveen Kumar came. So he asked that which rasha is helpful in the liver cirrhosis treatment and how it acts.
Rasa, Tikta, Kashaya, Tikta, Madura, isn't it? Kashaya, Tikta, and Madura. Kashaya, suppose Kashaya is useful in suppose complications. Pitta, all three are Pitta, isn't it? Mostly we use Tiktarasa, Katakuravini Kata, Aragavadini Veti, then Palatrikadi Kashaya, Unimbadi Kata, Patola Kataranya Kashaya. All these are Tiktarasa areas. Tiktarasa is Deepanapachana, isn't it? Deepanapachana and Pitahara. And Madhurasa, soothing action, and Balya, Brahmana, isn't it? Jivaniya, Vayaskara. These are all Rasayana. They are mostly Madhurasa. The Godikta we use. Godukta, Ikshaswarasa, isn't it? Mamsarasa. These are all Madhurasa Dravyas. And Kashaya often you use Tripalakvata, Palatikadi Kashaya. These are all the Tripala tablet. These are Kashaya Rasayukta Dravyas. Kashaya Stambhana. In Virechana also, in Atisara symptom, there you can use Kashaya Rasayukta. And in the amla like symptoms, gastritis like symptoms, like in say alcoholic liver disease and cirrhosis, we can give Kashaya Rasayukta Dravyas. Tripala Kashaya is useful. So these are the major. In the Katu, Amla Lavana, they are best avoided. Katu, why avoided? Dipanapachana dravyas, we can give Katu dravyas, but we should not, we will see the stage and stage of disease. Usually Katu increase the Pitta, isn't it? So Katu, Amla Lavana, Amla, Pitta, Vruddha, and Lavana, if you give, there will be retention of sodium and water inside the body. That will increase the extent of ascites, extent of bilateral demands, and analysis. Naturally, you have to restrict salt. Depends. But serum electrolyte sometimes derange. Hyponatremia is as a complication may occur because of diuretic action of the drugs. Then you have to supplement salts. That depends, isn't it? Normally, you give low salt diet. So, Kattam is best avoided. Kattu is given in as Deepanapajana most of the times. Otherwise, it is not good. And Amla Lavana, they are mostly avoided. But still in my practice, if a patient complains of loss of appetite, sometimes or vomiting, nausea and vomiting, I suggest this one. Which one? The this Ardhraka Swarasa and mixture of Ardhraka Swarasa and Nimbu Swarasa and Sanjalavana. So Ardhraka Swarasa, Nimbu Swarasa, Sanjalavana. You see, Katu, Amla, Lavana, all the three are there. But this acts as a appetizer and deepen also. This digestive also. So you have to see the stage. Sometimes patient comes with severe vomiting, nausea. Then you have to give mixture of this. I have given so many patients this Ardhaka Sarasa, Nimbuka Sarasa, and Chandrana. Mixture if you give 2 or 3 times, then nausea, vomana, chardi, this will stop, and this will increase the appetite and increase decrease the ruchi and decrease the Agnimanti symptoms. That also there. You have to see the state and state of disease, and you have to plan the treatment.
Thank you, sir. Thank you. Another questions from my participants. There are lots of questions there for you, and because of very valuable topics, and you give such a good lecture in that topic. So another question is that, sir, Dr. Krishan Kumar, sir has asked one question that please share Rasha Aushodhis which can use in fatty liver and cirrhosis.
Rasas, huh? Rasas.
Please share Rasha Aushodhis which can
Rasas,
use in yes, sir, in
okay.
fatty liver and cirrhosis.
In
And there are
fatty
two or
liver,
more questions is there for sir. So yes.
in fatty liver, you can give Gugulu Yukta Dravyas. Gugul Kalpas, isn't it? Gugulu is Medonilahara, isn't it? And Gugulu is considered as hypolipidemic, isn't it? Also, anticholesteremic. So you can give Kanchara Gugulu, Medovara Gugulu, Amrtati Gugulu, Navaka Gugulu in case of fatty liver. I can also give this Aragavardhini Rasa, Aragavardhini Vati, sorry, and Palathikari Kachaya, Katukurohini Kwata, and Kumaryasava also in fatty liver. In case of cirrhosis of liver, the solutions are so you can give Punaravadi Mandura, Aragavardhini Vati, and Yakritari Loha, Yakra Prihari Loha, Punaravadi Mandura, Vasanti Vasma, then Raktapitta Kulakanda Rasa. This next. Then Pravala Panchamadarsa, Mukta Panchamadarsa, Ramaduga Rasa, Pravala Pishti, Mukta Pishti, Pravala Basma, Mukta Basma, like that. These are the most common the rasaushadhis you can give in case of cirrhosis and fatty regeneration of the liver. Fatty regeneration of the liver, you see, in obese persons also it is seen, isn't it? Most of the obese persons you see fatty liver. So you can give Medo Haradravyas, Medo Gramashadhis you can give, isn't it?
Okay, sir. So in regarding the Rasha Aushodhi, another is question also come from Avirat Arun Salve. He is asked also the same regarding that if patient is already in later stage of liver cirrhosis, will use of Rasha Aushodhis good or make it complicated?
Yeah, actually, you see, rasaushadhis you have to see, suppose hepatotoxic effect is there, then only it can damage the liver and can worsen the situation. If they are not damaging the liver, definitely you can give. In the later stages, like in case of esophageal bleeding, hematemesis, melena, isn't it? Then hepatic encephalopathy, carcinoma of the liver, and left ventricular failure, pulmonary edema. These are the few conditions. Electrolyte imbalance, severe diarrhea. These are the few conditions which are the later stages of cirrhosis of the liver. Then definitely you have to give modern treatment. You have to give the integrity of breath. Only resources may not have. You see, severe pulmonary edema is there. Only resources if you try, they may not help, because you see, if a drug is not working, that is equivalent to the drug toxicity. It is similar to drug toxicity. If a drug is not effective, then it will affect the patients in the same way as drug toxicity, isn't it? So you best avoid or better give other treatment. If you are Ayurvedic treatment only, and patient develops advanced stages of liver cirrhosis, then definitely you have to switch on to integrative medicine or combination of Ayurveda and allopathy, modern medicine. That is mandatory. Suppose bleeding is that severe from the esophageal varices, you have to stop bleeding. No, you have to give banding or cauterizing, whatever you do, balloon, intelligent balloon, so that you have to stop the bleeding in the esophageal veins. Isn't it? Suppose hepatic encephalopathy is there because of toxic absorbents. The toxins are absorbed from the digested, hemi-digested blood in the colon, in the intestine, leading to the brain, and there is ultrasensorium and delirium, isn't it? Tremor, trachoma, coma. Then you have to support the support treatment from the ICU or ICU. You have to take patient to ICU and you have to give the most advanced treatment. This is mandatory, isn't it? So, I suggest the best good medicines are there, such as there in Ayurveda. But in as complications and terminal stage, you have to reach on. You should know to detect the advanced stage, first of all. Then you refer to either to modern medicine or you give integrative system of medicine. So you should plan the treatment wisely so that better treatment should be given. Better management should be done in a patient of cirrhosis of the liver. If the patient is in the stage of carcinoma, definitely there is no treatment. You have to convince you have to inform to the patient attendant about the prognosis, and they have to start give treatment. Isn't it? In carcinoma, there is a very less chance of survival. Definitely it is. Liver carcinoma, liver malignancy, there is no still good treatment. Only palliative treatment is done. However, lifestyle is the quality of life is improved, and patient strength is improved by the palliative treatment, not radical treatment.
Thank you, sir. Another question also, sir. Dr. Krishan Kumar. He also asked, sir, second question is that medicine for low protein. And
Medicine.
another also, according to sir, another question is there in related that management of insulin in liver disease. So two question is the regarding it. So
Management
easily
of
answer the same.
yes, management of insulin.
Management of insomnia in liver disease
Inform.
and medicine for low protein.
Okay. Medicine for low protein, you give high protein diet. You give Deepana Pachana first. Cirrhosis is Deepana, the Agnimanja will be there. Na? Agnimanja, Ruchi, Chardi, etc. will be there. First you give Deepana Pachana. Pipali Cherapaka is the choice. Usually, Pipali is a Rasayana also, Deepana Pachana also. But it is stronger. It is made Mrudu by doing Shirapaka. So Pipali Shirapaka I have in so many patients with better results, isn't it? Then so Deepanapatana followed by Balya Brahmana and Jivani and Vajaskara Ushadis, Aharas. Okay. And coming to next question, what is the question?
question is, sir, that in the treatment for liver insomnia,
Insomnia. Okay. In insomnia, you
yes, sir.
give the Nidra Janaka, you give Jatamamsa Churna, Sarpagandhavati, isn't it? Tagara tablets. Same. You can give Shirodhara. You can give Shirodhara. Tailadhara you can do. Abhyanga. Tailadhara is effective. Or Takadhara. This is effective in insomnia, isn't it? So, CNS stimulants. CNS stimulants. So, CNS stimulants, I mean Ayurvedic, not modern. Sedatives, hypnotics, Ayurvedic drugs, which cause sleep, which induce sleep. Like we have Jatamsicur or Sarpagandha, Dhanavati, right? Or this one, Manasamitravattakam, Saraswata Adhishthana. So these drugs can be got. Tagara tablets, right? This can be got. In Panchakarma, you can give Abhyanga, but you have to see the patient's strength, isn't it? Slight massage should be given if the patient's strength is low. You can use Shirodhara. Shirodhara is effective in insomnia. I have seen. Shirodhara, you can Takadhara, Tailadhara. You can select the drug. Okay.
Okay, sir. So another question is there, sir. That cause of high cholesterol level, what to give? As mentioned, pasta as a high protein diet.
Cholesterol high is there. Cholesterol high is there.
In high
What?
cholesterol level, what to give?
Uh,
Because as in the sir, you already mentioned that
low fat.
pasta
Low fat.
as high protein diet.
High protein diet can be given, but low fat and diet, fat containing taila, grita, oily food, isn't it? The fat containing food that should be restricted. So fat is not digested if the liver function is now abnormal. Isn't it? You have to reduce the fat content in the food. Isn't it? High protein diet you can give. It is protein content amino acid and absorb and goes to the liver. No problem. No much problem. But low high fat diet damage really hypercholesteremia. That will increase cholesterol gain. Isn't it? Then treatment. Treatment of hypercholesteremia. You can use Medohara Aushadhis. Isn't it? Lagu Vyayama. Lagu Vyayama patient strength is less. So Lagu Vyayama you can say. Walking, daily walking, you can say. That. And you have yogasanas, very mild, you can suggest. Pranayama, you can say. And Aushadhis like Gugul Kalpas, you can. Kanchanara Gugulu, Medavara Gugulu, Amritadi Gugulu, Navaka Gugulu. This you can give. Vidanga can try.
Okay, sir. So another question is Dr. Ashish Tiwari. He asked that what will be our management or treatment protocol for SITs caused due to cirrhosis of liver?
Okay. In cirrhosis liver, if that is happened, so first and foremost thing, you have to give Deepanapachana diets with the high protein diet. High protein diet. You can give Mamsarasa, you can give this milk, paneer is there, milk protein. Casein is the milk protein, best protein it is. Quality protein in animal protein. Quality protein, casein. That is the milk protein. So you can give paneer you can give to the patient. It is very effective. But, in Ayurveda, they have told Dugda should be given. Dugda, isn't it? So, Godugda is a good one. Then treatment, I asked, yeah. Treatment, Virechana, I'm sorry. You can give Mutala Aushadhis. Virechana, Malavatan Loman drugs. Virechana drugs. Virechana means not classical Virechana. Virechana, daily perfusion, mild perfusion. Like Avipatti Karachurna, you can Prepara tablets. Avyarishta, this can be. Or can you this Shatsakara Churna, Panchasakara Churna, this can Trivya Churna, you can give. Then Mutala drugs like Pranavadi Mandura, Pranavasava, then Gokshara Bija Churna, Purnanavali Mandara. Then, yeah, that's all. Then, Shwetaparpati, this can give. Ukshiradi, Google also you can give. Then, then you can give other drugs like Palatrikadikasha, etc. You can give. Katuki Kwata, Aragavadinati. This you can give. Yeah, we have discussed, isn't it? Yeah.
Okay. Okay, sir. So, sir, another question is there. Dr. Rahul is asked, is there any treatment of decompensated liver cirrhosis in Ayurveda as the changes are irreversible?
The SREs will naturally, you are telling us, irreversible changes. We can't treat it. Cannot have a good effect. Isn't it? Can try. We can try with similar medicines. Isn't it? If changes are irreversible, you at least you improve the quality of life and increase the strength of the patient and immunity. That is the goal, mission. That is the goal of the treatment. Palliative treatment. Palliative treatment, not the radical management. That is the palliative treatment. Yeah, daily lives, comfortable living without pain, without agony, without distress, or less severe symptoms. That you can try with the Ayurvedic medicine or integrative medicine. Yeah, I think I have answered. So you are telling that it is irreversible. Only the goal of treatment is palliative treatment. You improve the quality of life, improve the strength of the patient, improve the appetite, and induce comfort in the patient till he lives. Isn't it? Counseling can be done. Repeated counseling. It also part of the treatment.
Another question is there, sir. Thank you, sir. So another question is there. Akansha Mori, she asked that in compensatory liver cirrhosis patient, what we can do to maintain a alpha fetoprotein that it cannot lead to the malignancy.
Yeah, I have seen a patient with increased alpha beta protein. Few patients I have treated, and alpha beta protein has reduced. I noticed. The patient was very afraid that he is having malignancy. But after my treatment for 2, 3 or 4 months, alpha fetoprotein has reduced. The treatment is similar. Treatment protocol is similar, isn't it? Like Aragatinati, Palatakadikosaya, Bumyavarkis Varasa, then Tripala tablets, Guduchika Shaya, Paratrika, sorry, Patalakataranadikashaya, Pataladikashaya, and the like, isn't it? Uh, yeah, Godantivasma, etc. So I have seen the alpha protein has came to normal. This is possible. Not all, I don't say all patients will respond to similar treatment, but as some patient has responded. Encouraging results has been got.
Thank you, sir. So another question is there, sir. Dr. Deepti Godbole, she asked Ayurveda management in hepatitis B.
Yeah, hepatitis B, actually it is a severe condition. Most of the times it goes to chronic active stage and fulminant hepatitis stage and ends in hepatorenal failure. Some patient has seen hepatitis B, the serum, yeah, this one, that antigen, Australian antigen will be positive, but the patient will not have any symptoms. That also possible. I have seen so many patients with the hepatitis B antigen is positive, but patient is having no symptoms and signs of jaundice. Is also possible. Simply I have given the treatment, similar type of treatment, but yeah, we can avoid the development of complications in hepatitis B with the Ayurvedic management, similar management.
Okay, sir.
Mumma milk is also is proved effective in hepatitis B. Dr. Uh, one PhD scholar has done research on Bhumya is also in hepatitis B, and he noticed that is effective in case of hepatitis B, isn't it?
Yes, sir. So you always mentioned in the research, it's very helpful for us also, sir, your research work and all. And we hope, sir, your some research will come in this regarding this topic in Ayurvedic liver cirrhosis. So, sir, is there another question? Is there diet in non-alcoholic fatty liver?
Diet and fat you give low fat fat containing foodstuffs best avoided. If obesity is there, I advise exercise, moderate exercise, daily walking, isn't it? And lifestyle modification advice. Non-diet therapy is means uh, this physical activity, the lifestyle modification very important in type of in case of obesity and sorry non-obesity fatty liver. So in Ayurveda it is told now Vyayama while telling the action and the lakshanas of Vyayama, Ayurveda is told Lagavam karma samartyam deeptogni medasaha kshayaha vibhaktagana gatratvam Vyayama upajayate. Isn't it? Lagavam shariragutva karma samartyam, that is the strength to do the work, and deeptogni increase in appetite. Medasaha kshayaha is very important finding. There will be decrease in fat by Vyayama. Vibhaktagana the body becomes competent and strong. These are the lakshanas of Vyayama, karmas of Vyayama. So moderate exercise is advised in fatty liver also. Fatty liver, what happens? In the inside the hepatocytes, there will be accumulation of fat, adipose, isn't it? So nucleus is put to periphery and extended nucleus will be there. The major portion of the cytoplasm is occupied with the fat. Naturally, you have to give medohara, ahara vihara, that will reduce the fat content even in the liver cells also. That will improve the fatty liver conditions. Drugs, can you Google Kalpas? Various we have discussed.
Okay. Another is question you already mentioned, sir, in your slides that about the liver abscess and its management. So, if possible, sir, please, Dr. Avijit, and he asked about liver abscess management. So, in short, sir, if you give some advice in this regard.
Liver abscess, I have very few experience in treating liver abscess, frankly. Liver abscess, amoebic liver abscess sometimes occurs, but I have not seen cases, frequently cases of liver abscess. You can try with this anti-amoebic drugs. Suppose amoebic liver abscess is there, you can give Kutajaganavati, Kutajarista like that. I have not treated these liver abscess patients, so I have less experience in the case of liver abscess.
So, the last question is there, sir. What lifestyle mistake can aggravate the condition of liver cirrhosis? So, it is the final suggestion from your side, sir. What we will do for that?
Lifestyle means so you see now the life is stressful, isn't it? Where you see increased psychological stress, depression, anxiety, very common, isn't it? Causes are many. There will be conflicts within the family. There will be there in the working area atmosphere also there can be some misunderstanding and some stress. These stress, that patients when depressed, he will take more alcohol sometimes, more alcohol, or it'll be sedentary lifestyle. The other uh, lifestyle also may increase the resources, cirrhosis. Common cause I have seen cirrhotic patients, alcoholic intake. And this alcoholic intake, increased alcohol intake, most commonly seen in patients who are depressed. Isn't it? Depressed. In depressed patients, they go for alcoholism, and then they take for longer time, they will become dependent, and then they lead to they will develop cirrhosis, steatosis, hepatitis, and cirrhosis. So very important, stress management. You have to alter the lifestyle. Yeah, this pranayama you can do. Pranayama can be advised, isn't it? Regular exercise, uh, yogasanas, uh, yogasanas, some common yogasanas. Maybe that is better. Yoga doctor can is better than me. And pranayama is very useful. Pranayama, why? Pranayama is anti-stress action. So in the repeated pranayama, that will increase the vagal tone. The sixth and tenth canal now, its tone is increased. That is the depress of the heart. So that is a parasympathetic action over the heart. Naturally, heart, the stress effects of the heart, stress effects on the heart will be reduced. The patient's willpower will be strong. He will have anti-stress effect by pranayama. When stress is less, naturally he consumes less alcohol, isn't it? That will lead to less damage of the liver and chance of developing cirrhosis is less. So pranayama, regular exercise, walking, hmm, walking, and following dinacharya and dacharya, and sadhurta. Sadhurta also very important. That also improves the willpower and anti-stress effect. So patient will have less stress when he followed sadhurta, acharya sign. They are very important. The course of good conduct, what to do, what not to do. These are very important, isn't it? So that can reduce chance of liver. In Ayurveda, the most common, most popular shloka is there. Nityam vihara sevi samikshakari vishesh asakta tata samaha satyapara kshaman aptopasevi bhavati aroga. Isn't it? This what's called in this also alcoholism and cirrhosis. Nityam hitahara vihara sevi. Hita and mita ahara and vihara always. And samikshakari works does duty or its behavior of only after evaluating the situation twice. Samikshakari vishesho asaktaha. The indulgence in the worldly affairs less the isn't it? The sense organs involvement in the environment. There should be madhyama yoga, isn't it? Datapanam. One should do charity. The part of his income should be regularly given, donated to a needy person. Dataparaha, Satyaparaha, always tell the truth. That person will have less chance of undergoing anxiety or depression or mental stress. Isn't it? Satyapara, Kshamavan. One should have tolerance, forbearance. Tolerance is very important. So this also comes under the lifestyle and behavior. Tolerance, Satyapara, Kshamavan. Aptopasevi, regular consultating aptas. Apta means not the God one. The apta means rajastamo nirmavtaha tapo jnana balena ye. Tesham trikala mamalam jnanam avyatam sada. Apta ashishtaha buddhaste samshaya apipareya. That is told in Charak. Aptas knowledgeable persons, wise persons. We have to do consultation regularly, these wise persons. We have to get suggestion. That will increase our vital power, immunity. Willpower also. That will improve our lifestyle also. These are very practical, isn't it? So these will lead to hamper, will stop or check the onset of disease, any disease. Even it goes in the series of liver also. Series of liver, most common alcoholism. Alcoholism that will be due to a person usually takes alcohol for prolonged time when he under stress or some worries similar. So these lifestyles changes can be done to improve the willpower, reduce the stress, anti-stress effect, and alcohol intake can be reduced, and we can treat the stress.
Okay, sir. So this is the end of the question session. I am hand over to Dr. Preeti ma'am. So she will do for the further. Thank you, sir.
Thank you, Dr. Satchal, for
Yes, sir.
arranging my lecture. I'm very grateful for you. Thank you.
Thank you so much, Dr. Samshul. It was a very nice interactive Q&A session, and so many questions we got from our audience also. All our participants participated actively in this session, and it is really a pleasurable moment for me because after so many webinars, I think this session extended for the longest time, Q&A session. And sir also very beautifully answered all the questions, and I think all the queries of our audience are also resolved. And sir, still we have many questions, but dear delegates, today's topic was liver cirrhosis, so we only selected questions regarding liver diseases. So please don't feel bad. In other topics, other diseases, when we will discuss, we will take up all your questions and all your queries, and we'll try to resolve everything. And sir, one more thing, our audience is asking for your contact number. If you permit, then we will surely share it. Sir, with all your permission.
I'll share it.
Okay, so sir is sharing his contact number, and you can note it down, and we will also share his contact number so that you can ask him. He's a very knowledgeable person. His hands are very fine in practice, and he will surely help you with your queries and all the cases also where you are stuck or complicated. Sir will surely help you. So sir has shared his contact number. I will read it out: 9845387720. You can note it down, and you can also contact him directly. So thank you so much, sir. With this, I will invite our Dr. Shrinas BS from our organizing committee. He is the assistant professor from Panchakarma department for vote of thanks.
Am I audible, ma'am? Hello?
Yes, you're audible.
Yes. Tasmadacharya Paryantam Vande Guru Parambaram. A warm good evening to all of you. It's a great journey from last 20 months. We reached the 20th Parva of Prabodhini now. It's a great journey. So we have to move more webinars we have to conduct. So these all things because of our respected chairman, sir, Sri BABU Singh Ayurvedic Medical College, Dr. Shailendra Yadav, sir, and our chairperson, Dr. Sunitha ma'am. We have give to big thanks to both of you because they are the backbone for all the webinars, all the other activities from our institution. Also, I would like to thank our respected principal, sir, Dr. Manjunath NS, sir. He is a very motivative person, and he is giving more guidance to inspiring such a wonderful type activities. So I would like to thank you, sir. So another thing is our guest speaker is Dr. Shripathi Acharya, sir. Today he made a wonderful journey of liver cirrhosis because from starting from the symptoms and the histological studies and also the treatment aspect is from the vast experience. He given a great knowledge for us. So thank you very much, sir. For a limited time also, sir agreed to give the time for our webinar. So very thankful to you, sir. Thank you very much, sir, for your valuable time and your vast knowledge. And I would like to thank our KC department, Kajikilsa department, Dr. Sanjay Kumar, Mr. Sir, Professor and HOD, and Dr. Pradimai Sahu, ma'am, Associate Professor, and lecturers, Dr. Sansil Islam. He's the one person who has arranged our Shripathi Acharya, sir, to us. He's a great personality. Thank you very much, sir. And also Dr. Hadev, sir, and Vishram Gaur, sir. And I would like to thank to the organizing committee of Prabodhini webinar series, Dr. Nihar Ranjan, sir, Associate Professor, Department of Panchakarma, and Dr. Pradimai Sahu, Associate Professor, Department of Rai Chikitsa, and myself, Dr. Shrinas, Assistant Professor, Department of Panchakarma. And I would like to thank all the teaching faculties in our college because they are giving much support to the conduction of our webinars in all the departments. They are regularly giving updates and all the successful conduction of the webinar. I will thank you all. And another thing, is the main inspiration and main backbone for all these our webinars. We are guiding force is our respected and our dear delegates, because they are the main force. We have to do that, because we know that Ayurveda is such a wonderful Shastra, because you know that Shastram Jyoti Pragashartam Darshanam Vibhanamadi. Because Shastra is giving the Jyoti, that Jyoti have to enlighten to the world, then only we have to show the power of Ayurveda. So the power we are know that already. Our sir also, our Acharya sir also given such ideas, but after the given the knowledge, from that knowledge how we have to spread to the society. The acharana and the prajarana is very important. That prajarana purpose we started this webinar series from the sake of God Dhanvantari and all our respected people. We are going to this journey in a good way. So we are hoping that to continue the webinars in such a wonderful way. Go on. So I would like to tell that this Jyoti we have, because another thing is our Acharyas tell that Jyotir Vaidyu Nirantaram, the Jyotisha, Ayurveda, the Shastra, we have to study daily. We have to sharpen our knowledge. Daily have to sharpen the knowledge. Otherwise, it should be like the ashes, without ashes is covered with the fire. So we have to polish that. So that polishing, it will make the our power of the Shastra, because know that Brahma Samhita is this much of slogas. From that, we are getting to the limited slogas we are studying. So the Ayurveda in a one Janma is needed to study the Ayurveda. So we have to study it daily. Then only we have to update the power of Ayurveda. Because the Tadaksharam Adhigamyade we are telling, because we have to read not the lines, we have to read in between the lines, when only the Shastra Tattva will get. So that purpose, we are started this journey. We are getting very good people, good valuable speakers in our webinar. So coming time also we have to do the same. So hoping to all we keep in touch with us. So from this, I will quote this from our Vivekananda quote, Utishchada Jagrada Varani Bodhuda, never rest until the goal achieved. So by this, I will wind up this. Thank you all. Thank you. Namaste.
Thank you so much, Dr. Sheenas. Very beautifully you paid your gratitude towards all. And with this, we will end the scientific session. Thank you so much to our guest speaker also, Shripathi Acharya sir. Till the end, he's still there with us, and so many delegates who are still waiting till the end. And with this, we end our session. You all will be receiving your e-certificates. We will check your attendance surely because it is compulsory. So within 7 working days, you will be getting your e-certificates. So don't worry, please be patient, and please don't leave our Prabodhini webinar, that group, WhatsApp group, because all the updates of further future webinars will be updated in that group only. So please stay with us, and all the delegates, we are very thankful that you are all participating actively, and you are making our Prabodhini webinar series successful. With this, we end our 20th Parva of Prabodhini webinar series. Namaskaram to all.